Hello, everyone. Today we are going to be discussing HIV in detail and its prevention as a podcast.
All right, diving right in today, it's HIV AIDS. We've got some really interesting stuff to go over, pulled from the CDC, their About HIV page. It's from November 2024. And also a Medscape piece, HIV Infection and AIDS, just came out January.
Oh, very recent.
Yeah, so we're really looking at the latest here.
Yeah.
And I guess maybe the best place to start is, for anyone who maybe needs a little refresher, what exactly are we talking about when we say HIV?
HIV, that's human immunodeficiency virus, and it's all about the immune system. It attacks those cells that are supposed to be protecting you from getting sick.
Right, so it's kind of turning your defenses against you.
Exactly. And the cells it really goes after are these things called CD4 cells. And over time, if it's not treated, HIV can really weaken the immune system to the point where even a minor illness could become very serious. That's when we start talking about AIDS, acquired immunodeficiency syndrome.
Okay, and that's where things can get, obviously, really serious. But one thing that really stood out to me, especially from that Medscape article, is how much hope there is now. It's not just managing symptoms. People are living long, healthy lives.
Oh, absolutely. Treatment has come such a long way. And the fact that effective treatment also prevents transmission, that's huge. I mean, that changes everything for public health, for fighting stigma.
I kept seeing this phrase, undetectable equals untransmittable. I get the idea, but I'll admit I don't totally get what it means.
It's simple, but so powerful. If someone with HIV is on treatment and their viral load, the amount of virus in their blood, is undetectable, they cannot transmit it to sexual partners. It's been proven.
Wow.
It gives people with HIV the ability to have healthy relationships without that fear of transmission.
That's really incredible, and it makes getting tested, getting treatment, if you need it, even more important.
No, got it. Knowing your status, that's the first step, positive or negative. It's about taking control of your health.
The CDC says everyone 13 to 64 should get tested at least once. But how do you know if you need to be tested more often? What are these risk factors they mention?
Well, things like having unprotected sex, especially with multiple partners, or sharing needles or having other STIs, those are all things to consider. But honestly, even if none of that applies to you, getting tested regularly, it just gives you peace of mind.
Makes sense. Makes sense. What about symptoms? How do you even know if you've been exposed to HIV in the first place?
Some people, a few weeks after infection, they get flu-like symptoms, fever, fatigue, sore throat, that kind of thing.
So it's just like a regular cold or flu.
Yeah, easy to miss, right? But it's actually a sign that your body is fighting back. Your immune system is trying to control the virus, but it needs help to win that battle. The problem is a lot of people, they don't have NRA symptoms early on.
So you could have it and not even know.
That's why testing is so crucial. It's the only way to know for sure. And the sooner you know, the sooner you can start treatment if you need it.
And how is HIV actually transmitted? I feel like there's so much confusion out there.
There really is. It's important to stick to the facts. It's spread through certain body fluids, blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk. But those fluids have to come into contact with a mucous membrane, like the lining of the rectum, vagina, or opening of the penis, or damaged tissue, or be directly injected into the bloodstream.
So it's not just the fluid themselves, but how they enter the body.
Exactly. Casual contact is totally safe. Hugging, shaking hands, sharing food. The virus can't survive for long outside the body.
That's reassuring to know. It helps to, separate fact from fiction. So if someone is concerned about preventing HIV, what are the best ways to protect themselves?
Several things you can do. Consistent condom use during sex is key. And never share needles. That should go without saying. But we also have these amazing tools like pre-PP and PEP.
I've heard those terms, but break it down for me. What are pre-P and PEP?
Okay, so pre-EPI, that's pre-exposure prophylaxis. It's a medication people at risk can take every day to prevent infection. Kind of like a daily vitamin, builds a shield against the virus. PE, that's post-exposure prophylaxis. It's a course of medication you take after potential exposure. You have to start it as soon as possible, ideally within 72 hours.
So pre-P is preventative. P is like emergency care.
That's a good way to think about it. Both are really effective at preventing infection, and they're becoming more and more accessible.
So we've talked about preventing transmission and knowing your status through testing. But what happens if someone does test positive? What's the next step?
The good news is we have very effective treatment. It's called antiretroviral therapy, or ART.
RT. Okay, what is that exactly?
It's a combination of medications. They work together to stop the virus from replicating in the body. Basically, they stop it from making copies of itself. And it's really important to start ART as soon as possible after diagnosis.
The CDC really emphasizes that. What happens if you delay starting?
Well, the longer the virus is replicating unchecked, the more damage it can do to the immune system.
That makes sense. And the Medscape article talked about how ART is all about reducing that viral load, so the amount of HIV in the blood, and the goal is to get it undetectable. Which brings us back to undetectable equals untransmittable, right?
Exactly. Achieving and maintaining an undetectable viral load, it's not just about preventing transmission, it's also the best way to protect your own health and prevent the virus from progressing to AIDS.
So ART is really a powerful tool in managing HIV. And to understand that management, we need to understand how the virus progresses, right?
Right. The CDC outlines 3 stages of HIV progression: acute HIV infection, chronic HIV infection, and AIDS.
So what happens in that first stage, the acute infection?
That's when the virus first gets in and starts replicating like crazy. This is when you might see those flu-like symptoms we talked about. It's your body's first response to the infection.
And then what? What happens in the chronic stage?
Well, the virus is still active, but it's usually being controlled by the immune system. People might not have any symptoms at this point, and it can last for years.
But without treatment, I'm guessing things can take a turn.
Yes, the risk of progressing to stage 3 AIDS, that increases. Without treatment, the virus keeps weakening the immune system, makes the body vulnerable to serious infections.
So those are the 3 stages. But the Medscape article really highlighted that with effective treatment, progression to AIDS is much less common now.
It's true. It really shows how far we've come in HIV treatment and care.
Speaking of research, there was this fascinating detail in the Medscape article about a potential cure using stem cell transplantation.
Oh, yeah. It's about using stem cells from a donor with this specific gene mutation. It makes them resistant to HIV. It's still early days, but it does offer a glimmer of hope.
It's exciting to see that kind of progress. It feels like we're on the edge of some major breakthroughs.
We are, and we'll get into that cutting-edge research a little later. But for now, the important thing to remember is we have the tools to prevent transmission and help people with HIV live long, healthy lives.
That's a really powerful message.
It is. Knowledge and awareness are key. So, ready to get a little more technical.
Oh yeah, bring on the science. You mentioned earlier that HIV attacks those CD4 cells, but I'm curious about how that actually happens, at the cellular level.
Oh, HIV is a retrovirus, which means it carries its genetic information as RNA, not DNA, like our cells.
Okay, RNA, not DNA, so what's the big deal?
Well, to infect a cell, it has to convert its RNA into DNA, and it uses a special enzyme for that called reverse transcriptase.
Reverse transcriptase. That sounds pretty complicated.
Think of it this way. Our cells have these instruction manuals written in DNA. HIV comes along with its own manual, but it's written in RNA, a different language.
Okay, I'm following.
Reverse transcriptase is like the translator. It converts those HIV RNA instructions into DNA so the cell can understand them.
So it's basically rewriting the instruction manual of the cell. That's kind of sneaky.
Exactly. And once that viral DNA is integrated into the host cell's DNA, it can take over the cell's machinery to make more copies of itself.
So it's like a hijacking.
Pretty much. These new viruses then bud off from the infected cell and go on to infect other cells.
And the main targets, like you said, are those CD4 cells, also known as helper T cells. They're like the conductors of the immune system, right?
Perfect analogy. They coordinate the whole immune response, so when they're depleted, the immune system is in big trouble.
The Medscape article got pretty deep into the weeds on this. They mentioned something called CCR5. What is that, and why is it important?
CCR5. It's a protein on the surface of CD4 cells. It acts like a doorway for certain strains of HIV to get in.
A doorway, so if the virus can't get through that door, it can't infect the cell.
You got it. And what's fascinating is that some people have a genetic mutation that changes that CCR5 doorway, makes them resistant to HIV infection.
Wait, so some people are naturally immune to HIV?
Pretty much, if they inherit 2 copies of this mutation, one from each parent. They're practically immune, and those with 1 copy might have slower disease progression.
Wow, that's amazing, like having a natural shield.
Yeah.
But the Medscape article also mentioned that over time, HIV can evolve and start using a different doorway. One called CXCR4. Why is that a problem?
Well, CXCR4 is another protein on those CD4 cells. When the virus switches to using that doorway, it can really speed up the decline of CD4 cells, which leads to faster progression to AIDS.
So it's like the virus is changing its tactics, getting more aggressive.
It can, but that usually happens later in the infection, and effective treatment can prevent it.
It makes me think about the body's own defenses. I mean, the immune system is trying to fight back this whole time, right?
Oh, absolutely. It's a constant battle. Certain immune cells, like cytotoxic T cells, they work to destroy those infected cells.
So it's like a game of cat and mouse between the virus and the immune system.
You could say that, but HIV is a master of disguise. It mutates rapidly, constantly changing, so the immune system can't keep up.
A moving target. That makes sense, why a cure is so hard to find. But with treatment, we can help the immune system keep the virus in check.
Exactly. ART doesn't eliminate the virus, but it suppresses it. So it can't replicate effectively, and the immune system has a chance to fight back.
We've talked about the acute and chronic stages and how the virus can lead to AIDS without treatment. But what exactly is AIDS? What happens in that stage?
AIDS is the most advanced stage of HIV infection. It's defined by a severely weakened immune system, which leaves the body vulnerable to all sorts of opportunistic infections and cancers.
Opportunistic infections, those sound pretty scary. What are they exactly?
These are infections that wouldn't normally cause serious problems in a healthy person. But for someone with a compromised immune system, they can be life-threatening. Things like pneumocystis pneumonia, a serious lung infection, candida infections, which can affect the mouth, esophagus, or vagina, and toxoplasmosis, a parasitic infection that can affect the brain.
So these infections are just waiting for the immune system to weaken.
In a way, yes, and that's why preventive measures like prophylactic medications and vaccinations are so important for people with HIV.
Sounds like a constant battle to stay healthy when your immune system is compromised.
It can be, but with effective treatment and a proactive approach to healthcare, people with HIV can live long and healthy lives.
That's good to hear. And it seems like the Medscape article was really emphasizing that while we've made incredible strides in treatment, the social context of HIV is just as important.
You're absolutely right. HIV AIDS isn't just a medical issue. It's intertwined with social issues. Stigma, discrimination, inequality, all of that plays a role.
The article talked about those early days of the epidemic, when there was so much fear and misinformation about HIV/AIDS.
It was a different time, a lot of stigma, and it was often seen as a disease of marginalized groups, which fueled fear and discrimination.
And sadly, some of that stigma is still around today.
It is, and it can prevent people from getting tested, getting treatment, getting support. That's why it's so important to keep educating ourselves and others, to challenge that misinformation and advocate for policies that promote equality and access to care.
Speaking of advocating for change, the article also highlighted the global disparities in access to HIV prevention and treatment.
It's true, the impact of HIV/AIDS isn't felt equally around the world. Sub-Saharan Africa, for example, is still disproportionately affected.
What are some of the factors contributing to these disparities?
It's complex, but it really comes down to inequalities in healthcare, education, and economic opportunities. Poverty, lack of access to quality healthcare, social stigma, all of those play a role.
It's a reminder that HIV/AIDS isn't just a health crisis, it's a social justice issue.
Exactly. We need to address those underlying social and economic factors, the ones that contribute to the spread of HIV and create barriers to care.
The Medscape article also talked about all the activism that shaped the response to this epidemic.
It's been amazing. From grassroots organizations to scientists, so many people have fought for better funding, better treatment options, greater public awareness. It's been incredible.
It's really inspiring to think about the courage and resilience of those who've been on the front lines of this fight.
It's been a long and difficult journey for sure, with both victories and setbacks. And while we've made huge progress in the fight against HIV/AIDS, the journey isn't over.
So where do we go from here? What are some key takeaways you want our listeners to remember?
Well, I think the most important thing is that knowledge is power. The more we understand about HIV/AIDS, the better we can protect ourselves, support those living with the virus, and advocate for change.
And that knowledge goes beyond just the science, right?
Absolutely. We need to be aware of the social, cultural, and economic factors, the things that influence the spread of HIV and access to care. We need to challenge stigma and discrimination and work together to make sure everyone has the resources they need to stay healthy.
We've covered a lot in this deep dive, from how HIV works to the global impact of the epidemic. It's been really eye-opening.
It has, and remember, this is just the beginning. There's always more to learn, and your continued curiosity is vital in the fight against HIV/AIDS.
We've come a long way, but it makes you wonder, what are the big questions, the ones researchers are still trying to figure out?
Well, finding a cure, that's the holy grail, right?
Yeah.
We've got treatments like ART that can suppress the virus, make it undetectable, but it can still hide out in the body in these reservoirs, really hard to get rid of completely.
So even with an undetectable viral load, the virus is still there. That's kind of unsettling.
It is, and that's why researchers are looking at all sorts of ways to target those reservoirs. Gene editing, immunotherapy, even ways to boost the immune system's ability to clear the virus. Lots of possibilities.
So many different approaches. That's encouraging. What about prevention? Anything new and exciting happening there?
Definitely. Besides pre-epi, which is already super effective, they're working on long-acting injectable forms. You'd only need a shot every few months.
Wow, that would be huge, especially for people who have trouble with taking a pill every day. What about a vaccine? I feel like that's been the goal for so long.
It has, and it's been a tough one. HIV is a tricky virus. It mutates so fast.
Yeah.
Hard to develop a vaccine that can keep up with all those changes.
A moving target, basically.
Exactly. But even with those challenges, researchers are making progress. New vaccine strategies targeting multiple strains of the virus, stimulating a stronger immune response. It's all happening.
It's really good to hear that there's so much research going on. It gives me hope. It also makes me think about how much our understanding of HIV/AIDS has changed over time. I mean, in the beginning, there was so much fear, so much we just didn't know.
Yeah, it's amazing how far we've come, both scientifically and in terms of public awareness. Back in the early 80s, when HIV/AIDS first appeared, it was a total mystery. No test, no treatment, just a lot of fear.
And that fear, unfortunately, led to a lot of stigma and discrimination.
It did. People with HIV/AIDS were often shunned, blamed. It was a dark chapter.
But even in those dark times, there was incredible resilience, incredible activism.
Absolutely. People with HIV/AIDS and their allies, they fought so hard for recognition, research, treatment. They challenged the stigma, demanded compassion, pushed for change.
And those efforts have had a huge impact. We've seen changes in public perception, medical advancements, social policies. It's remarkable.
It is. It really shows the power of advocacy, science, and human compassion. But like we've been saying, the journey's not over. We still need to work to ensure that everyone has access to prevention, treatment, and care, and that people with HIV/AIDS are treated with dignity and respect.
It's a powerful reminder that this isn't just about science and medicine. It's about social justice, about human rights.
It is. It's about creating a world where everyone has the chance to live a healthy and fulfilling life, no matter their HIV status.
That's a beautiful vision. And I think with continued research, advocacy, and open conversation, we can get there.
I agree. And that brings us back to you, our listeners. We've covered a lot today. What are you taking away from this? What questions are you left with?
We've explored the science, the history, the social impact, but this is just the start. Keep learning, keep asking questions, stay engaged. That's how we make a difference.
Remember, knowledge is power. The more you know, the more you can challenge those misconceptions. Have those compassionate conversations. Be part of the solution.
Thank you for joining us on this deep dive. It's been a privilege to share this information with you. Keep learning, keep talking, and let's keep moving forward together.